Hello, everyone. This is Dr. Hassaballa, and I'm here coming to you with another episode of the Healthcare Musings Podcast. And today we're going to talk about the new COVID vaccine that was recently approved by the FDA and recommended by the CDC. To jab or not to jab. And I'm, to be honest, and I'm kind of sharing my own personal thought process on this. I'm torn for me. COVID clearly is a different disease now than it was 3 years ago. I mean, there's no question about it. I have not had a severely ill COVID patient in my intensive care unit for months. At the same time, I have in my practice seen patients come down with COVID, but they typically have other disease processes, and it just doesn't cause the same disease. I think the virus has mutated and evolved to something that is very infectious, but probably is not as deadly. At the same time, just like flu, COVID in the right patient, in the immunocompromised patient, in the patient with multiple medical problems, can still cause severe disease. And I must say, as a parent with children, reading the experts saying that COVID did cause some pediatric deaths in kids that had no other underlying health problems was frightening to me. And so I honestly am torn for myself and my kids. I mean, there is a real risk of myocarditis from the vaccine. At the same time, the risk of myocarditis from COVID is multiple times higher, right? And so that's important to consider. For me, I got COVID in November of 2020. I got vaccinated with the primary series. I got the bivalent booster. And so I'm like, I should be good, right? I should have enough immunity, even though probably it has waned over time. And at the same time, for me, I work in an intensive care unit. The winter is coming. This is the time for respiratory viruses, and that includes flu, that includes COVID, and that includes RSV. And part of me is saying, I should take the newest COVID booster to maximize the protection for me so that I don't get sick. Because if I get sick, it can cause a big deal. I mean, clinicians nowadays, when they get sick, it causes staffing crises because we just don't have a lot of bench. This is across the country. I'm not necessarily speaking about my hospital in particular. It's just, I don't want to get sick. It just causes disruption for everybody and everything. And the messenger RNA technology has been demonstrated to be safe and effective. I mean, we've had real-world experience of hundreds of millions of patients, hundreds of millions of doses, and it has been remarkably effective at preventing severe disease from SARS-CoV-2. I mean, that's incontrovertible, right? I mean, and so part of me wants to get the booster to protect myself and just to maximize my armamentarium going into the winter. Now I have to get a flu vaccine that's mandated upon me as a clinician in the intensive care unit. The COVID booster is not currently, and so I'm strongly considering getting it just to maximize my protection, like I said before. For my parents, I'm also and my in-laws who are elderly, I'm leaning towards having them get both the COVID vaccine and the RSV vaccine, because RSV can be very, very severe in elderly patients. Same thing with flu. Flu can be, I've seen flu kill old people in the intensive care unit, especially with chronic conditions. So, to jab or not to jab, I think everyone has to make, I'm sharing with you my own thought process, because just to show you that it's not a one size fits all. I think everyone should consider the risks and the benefits. I think the vaccine is exceedingly safe and very effective. I wouldn't worry too much about side effects. If you react, that means that your immune system is working. That means your immune system is reacting. I think that's a good thing. I don't think myocarditis from the vaccine is a good thing. At the same time, for many people, I think the benefits outweigh the risks. So, that everyone has to make their own decision. I'm sharing with you mine. And definitely for flu, get the vaccine. If you're at high risk from RSV, get the vaccine. I think that's clear. COVID, if you are at high risk, if you're immunocompromised, have multiple medical issues, I would recommend you get the vaccine. I think the benefit far outweighs the risk. And for me, I'll let you know what I do when the time comes and they become available to me. Anyway, thanks so much for listening. And until next time, this is Dr. Hashem Hassaballa signing off.